Okay, so now we're going to talk about nebulizers. Probably the first piece of equipment that anybody who's been diagnosed with a respiratory illness receives in the home environment is a portable nebulizer device to take breathing treatments in their home. Just briefly, I'm going to talk a little bit about the compressor itself and then talk about the nebulizer cup that delivers that medication to you. A nebulizer or a compressor unit simply is a little air compressor. It puts out about 45 psi, which for the most part, that's about the same amount of pressure that's in your car tire. A breathing treatment, when you start taking your breathing treatment from the beginning to the end, should be about 8 to 10 minutes. If it's any longer than that, you might want to check the compressor. Again, these are not also designed to last forever. When you've been in a hospital situation, you've seen the respiratory therapist or the nursing staff there, they'll plug your nebulizer into the wall and it seems to go on forever. With the compressor that you have at home, it should last about 8 or 10 minutes. These units do have a little filter in them because they are a compressor. It's something that you want to be mindful of. And this particular nebulizer is one of many, many different designs, but all basically do the same, and they all have a filter. This one has a filter in the front, and it's just a little easy to get out. It looks like a marshmallow. It's just a little filter like this. And the manufacturer says take it out about once a month and rinse it out. Some people take it out once a week. I've known people that never take it out. My recommendation to you is about once a month, take a look at it. Because this does not filter the air that comes to you, it filters the air that goes to this compressor, and you want to have this working as long and as efficiently as it can. And that's where the filter is. The nebulizer cup itself, there are several different designs of the cups as well. When you go to your doctor's office and get a breathing treatment, they'll give you one. When you go to the emergency room, they'll give you one. Home care companies give you one. The designs are different for many different reasons, but all basically work the same. You've got a long section of tubing that hooks to the compressor itself that goes into the bottom of the nebulizer cup. When you put your medication in the cup, the air comes from the compressor, hits that medication from the bottom, and changes it from a liquid to a mist. Again, it should take you about 8 or 10 minutes to get the full therapy that you need from your medication. Depending on what your doctor has prescribed for you, whether you're taking a bronchodilator such as albuterol or Zopanex, or you're doing antibiotics, or you're doing some of the longer acting kinds of medication, you might want to have one or two of these that you rotate back and forth, the cups. It is a good idea to wash your nebulizer cup once a day. You don't have to wash it after each treatment, but it is a good idea to wash them once a day. This particular compressor has a little holster on the side so you can set it up and keep the puppies from chewing it all up. The way that you wash the cups, take the tubing off, and one thing I have found over the years with working with oxygen tubing, if you try to pull it straight off, you'll run into some problems, especially again as we all are getting older or weaker. If pulling it straight off doesn't work, wiggle it back and forth and you'll find it comes off much easier. Take the cup all apart and wash it with warm soapy water. Rinse it really well and let it air dry. I understand that earlier in the program they talked about a little recipe for a disinfectant you can use. The vinegar and water solution works excellent. Depending on who your insurance is, depending on your relationship with your home care company, you can have replacement nebulizer cups mailed to you every couple of months. So keep it as clean as you can and take good care of it. It helps to protect you and your health. If you don't keep it clean, infection tends to grow in the presence of a water or liquid, so you don't want to infuse any infection into your lungs with that. And that's your nebulizer. So you've been diagnosed with COPD and you're on oxygen and you want to take a trip. Your granddaughter's going to get married in Chicago next week and you've got to fly there and you just don't know how you're going to do it. At home, you use a concentrator all day long, and when you go out, you use portable tanks. In addition to the anxiety of flying in general, now you've got to figure out how to get your oxygen with you on the plane. That is doable. The Federal Aviation Administration has passed laws that allow people who are on oxygen to travel. Those laws, as you can imagine, over the years have changed. You cannot take your oxygen tank, your portable tank, with you on the plane. You can't take your concentrator with you on the plane, so how are you going to travel? Work with your home care company. There are portable machines that you can rent to take with you. You're used to and familiar with your concentrator. What these machines do, there are portable concentrators that work off of a battery. They're about the size of a briefcase on wheels, basically, and they are approved by the FAA. You can take them with you. What you need to do, again, is work with your home care company. You need to have a copy of your prescription with you, certainly in case you have a problem, and that'll allow you to get oxygen when you get where you're going. But you can travel with those oxygen concentrators. They are battery powered and they work the same way that a home oxygen system works. There's several different manufacturers out there, and it's my understanding that you'll see a website come up here. There's a couple of different companies that you can go directly to and get request literature on them. But all the home care companies also work with those and can help you prepare for your trip. It's always a good idea to start making your reservations well in advance. Certainly you want the airline to know that you're going to be traveling with oxygen so they can make accommodations for you. Because the smaller concentrators work on a battery charged, they don't need to have, a DC outlet available to you for the duration of your flight. But the flight attendants do need to know that you are traveling with oxygen so they can seat you accordingly and properly for the trip. And that is how you travel with oxygen.